Hello everyone, I'm Scott Vargo, Summit County Manager. We're joining you here today on Saturday, March the 7th, 2020 to talk about coronavirus or COVID-19. I'm going to introduce the panel that we've got here today: Elisabeth Lawrence, County Commissioner, Dan Hendershot, Environmental Health Manager, and Amy Wineland, Director of Public Health here in Summit County. We know how important the issue is within our community around coronavirus COVID-19. As you are likely aware, Summit County had the first presumptive positive case within the state of Colorado. The state is now tested or presumptive positive cases in a number of counties throughout the state of Colorado. We expect to see more cases within Colorado and likely locally within Summit County. So we wanted to provide some additional information to the public about the case that we did have as a presumptive positive, as well as general comments related to the COVID-19 situation and what you can do to protect yourself and continue to be active within the community. Yesterday, we offered up the opportunity to the community in general to provide questions about the topic, and we're going to make sure that we cover all of those questions as part of the discussion today. As you might expect, there's a fair amount of overlap in the questions that we received. So you may not hear your specific wording, but we're trying to cover all of the general information associated with each question that we received. So I'm going to start off with a question for Dan Hendershot. We got a number of questions related to the presumptive positive case and the timeline associated with him, where he might have gone out, where he might have eaten, other questions about his general whereabouts and movements within the community. So Dan, can you talk a little bit about that information and what we're able to share and why we're sharing it?
Yeah, the first thing I'd like to point out is that State Health, CDPHE, took over this investigation at some point, and they're no longer releasing location information unless that information is pertinent to control of communicable disease in the community. So info suggests that COVID is primarily being spread by close contact, less than 6 feet of separation between an ill person for more than 10 minutes at a time. So based on this, we don't feel like fellow consumers at a restaurant or that sort of thing are put at elevated risk.
All right, thank you, Dan. Amy, I want to chat with you briefly. In terms of one of the questions that we received was very specific to the location where the individual stayed at Slopeside, and questions about why it took so long, in their words, for us to admit that the individual stayed in Slopeside. Can you speak a little bit to the investigative procedure and how we shared that information?
Sure. I think it's just really important for everyone to understand that our way of contact tracing and investigations into communicable disease outbreaks or positive cases is evolving and it can take a long time to put together that timeline. As Dan had already stated, any presumptive positive case that is an out-of-state case, the investigation is being led by CDPHE. And unfortunately, that did cause a little bit of a lag, despite repeated efforts in trying to get the exact unit number of where this individual was staying. It caused a little bit of a lag for us to be able to act quickly. We were able to get that information by late Thursday night and immediately began our contact tracing and contacting the people that we believe may have been at risk at the condo complex.
And that included, Amy, all of the different individuals. There were some cleaning folks,
sure.
Some maintenance folks.
Yes, correct. There were 3 individuals that we had that rose to the level of most risk. That included a housekeeper, someone who delivered towels to the room, and another individual who replaced batteries in the carbon monoxide alarm. 2 of those individuals, the one with the who delivered the towels and the batteries, we were not concerned about. They were not in the room for longer than 10 minutes. did not have close contact with any of the individuals in the room. And then the housekeeper, Dan can elaborate on the conversation we had with her. What we were really glad to hear was that nobody had been in the room since this individual left, and it wasn't cleaned until 23 hours after they left.
Yeah, and we do have a series of questions that we received related to cleaning. I think just based on the flow of this conversation, maybe we'll move to that right now. And so I'll throw everybody on the panel here for a little bit of a loop. So Dan, we had a lot of questions that were related to the how long the virus can live on surfaces, how is the condo unit in particular cleaned, what other surfaces or issues are there around other common area spaces within the condominium, within neighboring condo units, even questions about chairs and gondolas and other sort of general public spaces and how those surfaces should or shouldn't be cleaned. What's the guidance associated with all of that?
Yeah, big question. Cut me off if I'm missing some of them as we're going along.
Or if you go too long.
If I go too long. So the important thing to start off with answering this question is we're learning a lot about COVID-19. This is a very new virus, as we've discussed a lot, and so we're going with conservative estimates and protocols for controlling it. Current information suggests it can live for several hours or even up to several days on a surface. The good news is that we believe COVID is spread by droplet, and conservative estimates are that these drop out of the air within 2 hours, so are not in the air where they can cause illness. So I think there's been a little bit of confusion on, we talked about the cleaning crew didn't go into the unit until 23 hours after it was vacated by the patient, so we feel like her risk was very low. The virus may have still been alive on surfaces, but because it's not still in the air, it didn't pose an exposure risk to the person who entered that unit. Let's see. It can land on surfaces such as doorknobs, handrails, elevator buttons, and other contact transmission type. This kind of transmission to humans has not been documented for COVID virus. However, so it's not believed to be the primary mode of transmission. However, it may be possible, so we continue to recommend routine cleaning of these surfaces. Again, we're being conservative in our protocols. We've been working closely with the property management company. As Amy referenced, this unit has not been occupied since the patient vacated it. We've requested that it remain unoccupied until they demonstrate to us that it's been cleaned to the CDC recommendations for these cases and these scenarios. What are we doing with the condo common areas is a question the public has asked, we've asked ourselves. We're working with that property management company to recommend routine cleaning and wiping of high-touch surfaces. Let's see.
And Dan, those are not recommendations that are necessarily specific to COVID-19. Those are sort of standard cleaning practices that you guys would recommend for all facilities at all times. So that helps with the spread of the common cold, helps with flu, and certainly could help with COVID-19 as well. Is that correct?
That's correct. COVID-19 is a very minor illness that's not a minor illness, it's circulating. I'm trying to be careful with my words so I'm accurate, but COVID may be circulating in our community at some point, certainly, but we've got a lot of other viruses that are circulating in our community, like the flu virus. And you're exactly right. These measures are adopted from what we know controls those viruses as well. We have interviewed the cleaning folks. We have shared information with them and other property management folks on how they can minimize their risk of exposure. We've had the question on, well, my unit is next to this unit. Am I at risk here? We don't feel like any of the residents in the neighboring units in the slopeside condos are at elevated risk just because they're in the same building.
Dan, with regards to the cleaning crews, my understanding is that we've also been in contact with other large operators within the community We've provided some information in Spanish as well, so that they can share that information with that community as well that may be involved in some of that service work.
That's correct. That's just one of the stakeholders in our community that we're really trying to reach out, again, in English and in Spanish. We're doing the best we can to share information that may be pertinent to our community to help minimize the spread of this illness.
Great, great. All right, anything else? Did you speak at all with regards to chairs and ski chairs and gondolas?
Oh yeah, we did have a question about whether we need to go out and clean and disinfect ski lift chairs, gondolas, whether hot tub use was a concern. We consulted closely with our partners at the State Health Department, and we don't believe that those are elevated risk of exposure to people who would subsequently ride on those chairlifts or use that hot tub.
Okay, great. Thank you, Dan.
Yep.
Amy, next one for you. We've heard a fair number of questions over the last several days, and actually for a couple of weeks prior with regards to mumps, because there is a mumps outbreak that is underway within the Keystone area, and we've had a number of Summit Daily articles and other content around that subject. Can you talk about how mumps now, in combination with COVID-19 being in the community, is affecting resources and our response to the mumps situation, and if it's growing, if it's stabilizing?
Sure. Our current case number is 28. We have 28 positive cases. It's important to understand that this is still confined to the employee population. No new community cases. We do have 5 pending tests now, currently. It's also important to understand that though we've been partnering with CDPHE all along with this investigation, they are now, their immunization branch is actually going to be taking over the entire investigation for our mumps response, so that we can divert all of our local public health resources to the COVID response.
Okay, great. Thank you, Amy. I'm going to go back to one other question that's out of order for the group, so I apologize for that. But back specifically to the individual case, the presumptive positive, did that individual know that he was contagious when he came to Summit County? Elisabeth, can you answer that one?
Yeah, he did not know he was contagious. I would consider him a responsible visitor. He traveled here, felt great, asymptomatic. It wasn't until days into his stay that he started to present any symptoms, and he did everything right, where he called, reached out to public health in the hospital, and really protected and isolated himself, and was at a low risk to other people.
And my understanding is he didn't know, there's been reports about the fact that a friend of his, a colleague of his, tested positive in another state that he had been traveling with. He didn't know that result when he traveled to Colorado?
That's correct. I think that's an important rumor to put to rest. He really was responsible. He came here. He had been to Italy, and his traveling partner in Italy tested positive, but after they got back to California, where they were residents, and he felt great, traveled here. So he did everything right that he could have.
Good. All right, Amy, back to you. Can you talk about how public health, how Summit County, how CDPHE are trying to protect us from additional cases, especially in an environment where we have so many visitors coming to visit Summit County?
Sure. I think what's most important to understand is that the best tool that people have is themselves when it comes to preventing the spread of this illness. We cannot emphasize enough the importance of personal hygiene and following guidance to wash your hands often with soap and water for at least 20 seconds, or use 60% alcohol, alcohol-based sanitizer. If soap and water is not available, avoid touching your eyes, nose, and mouth with your unwashed hands. Stay at home when you are sick. This is extremely important to help prevent the illness. Cover your cough and sneeze with tissue or with your elbow. Clean and disinfect surfaces frequently. Avoid close contact with those that are sick. If you are feeling ill with symptoms similar to those associated with COVID, it is really important to follow what we recommend. Managing your symptoms at home the same way you manage other colds is important, especially with mild illness. This could include a fever or a cough to the extent possible. If you do need medical care, contact your primary care provider and schedule a visit. Let them know that you might feel that ahead of time that you're concerned that you might have COVID, so that screening process can take place. We have been working with our healthcare partners on a system of really identifying who meets the criteria for testing, so please call ahead if you are feeling that you are at risk for that. Only contact 911 for emergencies requiring immediate life-saving care. And let them know if you are concerned that you might have COVID. That's extremely important for our system so that it's not overwhelmed. Restrict visits to the hospital emergency room or urgent care. Only individuals needing immediate care should be visiting these facilities. If you must visit the ER or urgent care facility, call ahead of time if you think you may have been in contact or may be at risk for COVID-19. It's really important to understand that this is going to be ongoing and could last in our community for a long time as we continue to see more cases. Depending on the severity of the outbreak, public health officials, we may recommend community actions to reduce the spread and exposure of this. And these actions can slow the spread and reduce the impact of disease. And there are many levels of what we could take in terms of, social distancing, closing non-essential businesses, closing down transportation. But these are levels of interventions that we will take only if necessary.
Great, thank you, Amy. You mentioned testing, so I'm going to jump to a set of other questions that we received related to testing from somebody via email. They're asking about Summit St. Anthony's Medical Center being the only facility that's testing in Summit, how many people within Summit have been tested, that there's a statewide number of about 185 folks that have been tested, so they're curious about, well, how do we compare to that? And then how many other presumptive positive cases might we have within Summit County? So do you want to just cover that quickly?
Yeah. So that's accurate. Right now, Summit Medical Center is the only place for testing. We are working on identifying other locations where tests can be, and these are not, we're not doing testing. I guess I want to be clear there. We are not conducting tests here. We are collecting samples to be sent to CDPHE for testing. That is where the testing takes place. We are looking and planning on opening additional testing sites. That information will be shared as soon as we have that. I'm trying to remember some of your other questions. Oh, cases. So it's important to know that we are continuing to test individuals. We are not disclosing the number of cases because the number is so low. I can tell you that we only have one presumptive positive. If we do have another presumptive positive, we will absolutely let the public know immediately. The number is so low, and that aggregated data is being collected at the statewide level and can be found on CDPHE website, coronavirus website, and it is updated every Monday, Wednesday, and Friday.
And can you elaborate just a little bit in terms of why is it important that that data is aggregated and rather than us sharing data when it is such a small sample?
Well, I think that we need to be protecting individuals' rights, and so if we have a really small number, it's easy to identify those individuals within a community, and that we just need to be safe in protecting those individuals.
Okay, great. Thank you, Amy. Elisabeth, I want to go to you. Amy talked a little bit about sort of discussions around closing this or closing that, or how we might react as the situation evolves. We have a question that came in that is, at what point would the government recommend that we close Keystone? And we could insert Copper Mountain or Breck Ski Area or any number of other things. So can you talk a little bit about that?
Right, that's a fair question, but we continue to monitor this situation with experts from the CDC and CDPHE. which stands for the Colorado Department of Public Health and Environment. And so we are monitoring the situation with them. If there is any new guidance, we will work with those agencies and follow that guidance. At this point, it's too premature or way too early to get into any assumptions like that.
Okay, good. Follow up on that for you, Amy. We've received questions about what criteria we're looking at that would cause us to close schools. So can you speak in a little bit more detail about, is there criteria, is there discussion with the state level, with the local level?
Yes, we understand that this is a huge worry for our community, as it is for all communities across the state and the nation. It's important to understand that the state is working on developing some criteria and guidance for locals around this topic and should be out very soon. But it's also important to understand that we also have local authority to do what we feel is right for our community, and that decision will be made in collaboration with our school district and other partners.
Okay, great, thank you, Amy. Let's see, this is for Elisabeth to start, and then we're going to turn it over to Dan to talk, not in too much detail, about some health regulations component to it as well. But Elisabeth, the question that came in is, what do I do if I'm sick and I can't go to my job as a server?
That's a stressful situation, and we understand that it's stressful and a hard decision. The simple answer is a recommendation is don't go to work if you're feeling ill. No matter what the illness is, whether that's influenza, gastrointestinal illness, various other things. It's simple, don't go to work, but that's easier said than done. Here in Summit County, we have a number of resources to help and assist with that, and that's something that we can provide more information on. You know, if we get to that situation where people are missing work, we do have resources in this community to help. I'll let Dan turn it over because there are some rules related to that.
Yeah, thanks. You know, we partner with our child care centers and restaurants frequently on this topic, and they are comfortable with the responsibility of their jobs. They understand the risk that their handling of food or caring for our kids poses, and they take that very responsibly. But it's true, if they are sick with a communicable disease, the regulations don't allow them to stay at work.
Okay, good, thank you. Another question for you, Elisabeth. This comes from a small business owner. If people don't come to town over spring break, I could really be in trouble. What are you doing to make sure that small businesses and employees who depend on the busy spring break period don't suffer?
So I think that's what we're doing right now. We're trying to educate our community, prevent the spread of the virus, and really reduce the alarm that an incident like this might cause. Currently, we are business as usual here in Summit County, and we will continue to stay in touch with our community if things need to be done in a different way. I think it's important to reiterate what's on the news, that more than 80% of people that have this virus have very mild symptoms. So at this point, we are proceeding on business as usual in Summit County. I think there's some good tips that we've reiterated that all of us are our best protection against this virus.
Yeah, absolutely, great. Let's see, this is another question, Elisabeth, for you. And it comes down to this idea, and I think we heard some of this the other day, is Summit County in some way prioritizing tourism and economic activity over the public health. And so how would you respond to that?
Yeah, that's not an either-or situation. Health and safety is obviously our chief priority, but protecting our public is what we do as well, for our community, our residents, as well as our economy. And so it's a complicated, nuanced situation, but we are here to help people understand the level of risk and what that means for them and our community.
Anything that either of you would like to add to that, that comment in terms of public health and its impact on the overall functioning of the community?
Yeah, and I would just add to that before I pass it to Amy is not to overreact to unnecessarily affect our economy in a negative way. And again, make smart decisions and turn to reliable sources.
To add to that, certainly for public health, the health is our priority to protect the health of our community. I think it is really important. We can't reiterate enough that it's individuals' responsibilities to follow recommendations that we're providing, and we can keep that in. We can keep the spread of this illness at bay if these basic guidelines are followed. And this includes travelers who are coming back from any level 3 travel notice countries. Currently that includes China, Iran, Italy, and South Korea. The recommendation is that these folks stay home for 14 days in isolation so that we can make sure that we are keeping, if they were exposed to this virus internationally, that we are going to keep it out of spreading here locally.
Okay, Amy, you can hold on to the mic. A couple of questions around the virus itself. Actually, a few questions around the virus itself. So, isn't it sort of just like the flu? And if it is, why are we so concerned? And will we see sort of an ebb and flow seasonality of this particular virus? And does the virus itself cause some sort of long-term issues as well?
Sure. That's a big question. So first, I'd like to reiterate that more than 80% of cases of COVID are mild illness. Fever, cough, things that can be certainly dealt with at home with over-the-counter medications. We really want to reiterate that only a small number of people who get severe illness should be going to our emergency room departments. We know that this is affecting older adults and those with underlying health conditions more severely than others. There are new CDC guidelines that have come out that older adults should really be hypervigilant, not go to community gatherings, should plan on staying home, make sure they have medications for a long period of time. As far as the seasonality question goes, it is not yet known whether the weather and temperature can impact the spread of this virus. We are learning so much all the time about this, and our guidance and recommendations are going to change based on that new information. As far as the differences between COVID-19 and flu, we certainly know that the symptoms are similar. We know that the transmission is similar. We know that we do have antiviral medications that can protect us from the flu, as well as a vaccine. COVID vaccine is not, we're not expecting a vaccine for over probably a year, so it's really important that the guidance that we're giving, people are following that.
And Amy, that's sort of an important point, that part of the reason why this issue is being treated in a different way than the flu would be is because it's new to the scene. And so you want to speak a little bit about what that means?
Sure. When there is a novel virus, it causes a lot of worry because we don't know much about it. We can't determine whether it is more severe than the flu at this point because we just don't have the data yet. Mm-hmm. What I can tell you is that COVID so far, as of March 6th, has caused approximately 3,400 deaths reported worldwide, 14 deaths in the U.S. as of March 6th. I know that number has increased this week. And then flu, as a comparison, has caused 300 to 600,000 deaths worldwide, 12,000 to 61,000 deaths in the U.S. per year. So we do know that flu, we have a lot better data on. We know that that is affecting especially our younger population. We've had over 100 child deaths for flu, and so it's really important to know the differences in the populations that are at risk.
Okay. One last question for you, Amy, and really one last question for the segment. There were comments with regards to the number of agencies that are involved in this situation. So whether it's local public health, state public health, emergency management folks, the federal government, and the comment that was made was there's too many agencies. So can you speak a little bit to the structure of this response and why it's important that we have a number of different levels and sort of a chain of command that we're working with?
Sure. There is a structure that we all follow here when we have an emergency event, and this happens when we have flooding, blizzard, power outage, a wildfire. It's something that we plan as a community to prepare and respond to. all ongoing all the time, and we activate that system when something happens. We need to have multiple agencies involved in this response because public health cannot take on all the needs that our community is going to have. We need to have all of these partners to respond to, you know, how, as questions come up and needs in our community arise, we need to have everybody, all hands on deck to help problem solve those issues.
Great. Dan, I'm going to ask you to take the mic and just as we close, reiterate some of the things, some of the steps that individuals can take to help protect themselves and help protect the community in general.
Yeah, I know we've talked about these quite a bit, but they're always a good reminder for folks. Stay at home if you have a fever, respiratory symptoms, or believe you are sick. Fever is 100.4 or more using an oral thermometer without the use of fever or other symptom-reducing medicines. Practice routine cleaning of your home, especially frequently touched surfaces. Practice hand hygiene, hand washing. If you don't have access to hand washing, use a hand sanitizer with at least 60% alcohol. Don't touch your face unless your hands are recently cleaned. Promote cough and sneeze etiquette. Get a flu shot. Practice social distancing. And then the other thing that we have available for folks, especially in a workplace, is we have signs that can help remind folks of these important steps.
And I think it's important, again, to mention that almost all of those things that you just mentioned, perhaps the 100.4 fever being the only exception, all of those are things that we would recommend for folks just every year, every day, every situation. It's not specific to COVID-19. It's just good personal hygiene and good personal behavior to help to prevent the spread of illness. Okay. Elisabeth, any closing comments that you'd like to make?
Sure. We are just appreciative of everyone's patience as we work through this. Being the first in anything is sometimes difficult, but now we know that unfortunately it's spreading throughout the state and other communities, and we will continue to stay in touch. We have a great team here and a wonderful staff, and really want to say thank you to our public health and environmental health departments for all you guys are doing, and we will continue to message out to our community and work with you as we tackle this.
Great. All right, that's all we have. Thanks very much. We certainly appreciate the interest within the community in the subject, and we appreciate all the questions, and we hope that we were able to answer all of the questions that you might have. If not, again, you can go to the county's website. You can seek out resources through that, along with referrals to different agencies and individual contacts as appropriate.